What you can expect after total hip replacement is hopefully a full recovery. You will be in the hospital for approximately 2 to 3 days. Depending on how well you progress while in the hospital, you'll either be discharged to home or discharged to a rehab facility. You are monitored while in the hospital by the residents, the doctors, the attendings, and the social workers to determine where you would be discharged to. Most times patients are discharged to home. When they are discharged to home, they'll have physical therapy come into their home for a couple of weeks. We control your pain with narcotic pain medication. The doctors and nurses work closely to give you the appropriate medication that will manage that pain. You're discharged from the hospital with pain medication, and our physicians will manage your pain for approximately 3 months after the surgery.
Physical therapy and occupational therapy are very important for the patient immediately following their surgeries, and then often beyond discharge from the hospital. Physical therapy and occupational therapy come in within the first 24 hours from surgery, and often on the day of surgery, to get patients up and out of bed and moving. The occupational therapists are most interested in making sure that you can safely put on your socks and shoes and take them off to maintain your hip precautions if that is applicable for a hip replacement. They want to just make sure that you know how to use the equipment that you're given and make sure that you can get in and out of the bathroom in a safe manner. After a total hip replacement, because of the way that the surgeon goes into your hip joint, you are not allowed to do certain motions for approximately 6 weeks after surgery. Those motions are bending over, so we say flexing the hip past 90, which, what does that actually mean? Which means you can't bend over necessarily to tie shoes, to put on socks, to pick things up from the floor. Also getting up from low surfaces, if you really have to bend to be able to get up, those are things you have to think about. And so the occupational therapist has fun tools that they utilize with patients to make sure that they don't violate their precautions. So the very first day that the physical therapist comes in to get you out of bed, they will also show you a folder that has your home exercise program in it. They will review the home exercise program with you throughout your stay, as well as any other information you may need as it pertains to rehabilitation after your joint replacement. There's contact information should you have any questions or concerns once you leave the hospital. It is very important that all hips go home with their home exercise program and continue to do the home exercises daily for at least the first 6 weeks from the surgery. For all joint replacements, total hips and total knees alike, getting in and out of a chair, you want to protect your joint, at least initially, because it will be sore from surgery. So we like to teach patients before they sit down to kick their operative leg or the affected leg out so that they don't bend the knee too much when they go to sit down, and just keep the joint protected as they lower themselves into a chair or onto the bed. For hip replacements, this is where that bending past 90 degrees precaution comes into play. We do not want patients getting up from low surfaces, so those should be avoided if you have a total hip replacement. Low toilets, low comfy couches, low beds are things to consider that you really should not be getting into or out of after a total hip replacement. Otherwise, you want to scoot your bottom to the front of the chair. You want to have a chair that has armrests, and you want to push up from the armrest to the standing position with your walker or crutches in reach. During your stay in the hospital, you may hear the term DME, which stands for durable medical equipment. And that is your rolling walker, your crutches, your canes, and they will all be covered by insurance. Your physical therapist will come in on the first day, make sure that You can get up and out of bed, and we'll make recommendations for the most appropriate equipment to get you in and out of bed and in and out of your home.
If it is a total hip replacement, most of those incisions are closed subcutaneously, which means there are no sutures or staples on the skin. They use a subcutaneous closure and then apply steri strips. We do not advise getting the area wet for at least 2 weeks. You should contact the surgeon's office at any time with any question you may have, especially if there are concerns of infection, those being redness, swelling, drainage at the incision site. There's always a risk of blood clot following these surgical procedures. Those risks are very small, but it can happen. So anytime you would develop any calf pain, swelling, shortness of breath, if any of those should occur, you should go directly to an emergency room. Your pain medication should be taken always as directed by the physician. We do recommend when you're in physical therapy that you take your pain medication prior to your physical therapy appointment if you can time it appropriately. If you need to contact the nurse liaison office, it's important that you leave your first and last name with appropriate spelling, your date of birth, and the best contact number for them to reach you. When refilling a prescription, it can be done either through the lifebridgehealth.org patient portal site, or you can call the prescription line